I very much enjoyed my time here at the University of Vermont Medical Center. We have a very strong-knit community that takes care of each other, but also fosters each other's growth.
What we're known for is a spirit of collaboration and communication between fellows and faculty. The way we structure our program ensures that we have a high clinical volume, especially during the first 2 years of our fellowship. And then in the third year is where they start subspecializing.
There are a variety of ways to give you the skills that you'll need to be a great clinician. Our approach is to do that in a mentoring relationship. The teaching that will occur in the care of patients, in the performance of procedures. If you look at some of the high-end procedures, consider, for example, TAVR procedures. We're one of the higher volume centers in the New England region. We have a very advanced electrophysiology program. We also have a full range of structural heart procedures.
The fellows are involved as oftentimes the first people to evaluate somebody who's coming in, but they also help run the teams. You know, you are supervising residents, medical students, and while also working directly with an attending.
We kind of mix the clinical, the research, and the education on a daily basis right from the start. For example, in the cath lab, it's all arm's length teaching, and the people that teach you are going to be our experts, they're going to be our program builders. Those are the same people that are going to be standing in the cath lab with you teaching. In electrophysiology, we have forerunners in physiological pacing. They are going to be the same people that round with you up on the floor.
You get, of course, a broad exposure and really in-depth, strong clinical foundation, which is something that I wanted. But at the same time, I could leverage relationships with the College of Medicine to get more training and experience in teaching and medical education. I could work with the Cardiovascular Research Institute of Vermont and continue doing research projects that I wanted.
As fellows, we really get to work with world-class physicians who are internationally recognized in the fields that they work in. Dr. Daniel Lescarton, for example, he's one of the pioneers in his bundle pacing, and Dr. Schneider has multiple patents to his name.
Being in an academic center that's under one roof, where you have a lot of these relationships that are easy to make and you see these people day in and day out, really was sort of the perfect mix.
The medical center is located on the campus of the University of Vermont, so you can reach beyond your cardiology mentors that may be able to connect you with folks across the campus, whether you are interested in basic research on the cardiology aspect of things, in computational modeling, engineering. We foster research and new development in a strong way.
We have the unique opportunity to work with medical students, residents, nurse practitioners, and our ancillary staff, and each day we get the opportunity to teach them as well as learn from them.
Through our teaching academy at the Larner College of Medicine, fellows have the opportunity to get involved with that teaching academy. Fellows have the opportunity to get involved in any type of research project that they would like. With our Cardiovascular Research Institute here, there's exposure to multiple different types of research projects, not only with classic cardiologists, but with hematologists who specialize in thrombosis, with physiologists who specialize in muscle physiology of the myocardium, with pharmacologists who specialize in channels and channelopathies and cardiovascular medications.
Our attendings are very available, eager to help out. They're very approachable. Their doors are always open.
If they're on the inpatient clinical service, they have access to their attending cardiologist all the time, but they can also branch off and speak to somebody from the structural heart disease program. They can speak to somebody from the electrophysiology program. They can wander over to radiology and speak to a chest radiologist. The access to the attending physicians across the board is basically 100%. When a fellow needs an attending, they can access an attending.
Before coming to UVM, I interviewed very broadly at more than 20 cardiology programs. I not only wanted a place which was very strong clinically, but a place that also felt like home. And UVM was exactly that for me.
One thing that impressed me when I first came to Vermont was how many people at some point in their training had come through here, whether it was medical school, residency, or fellowship, and then they never left. And so I think it's this sense of community that attracts people here and what keeps people here as well.
If you look around, if you talk to our graduates, if you talk to some current fellows, you will hear this again and again. This is a great place to live, and people are here for each other and inspire each other to be their best selves, not just at work, but also in life.
Being at the University of Vermont, the care of patients that occurs at this institution is second to none, and you can have access to high-quality training, access to cutting-edge research, and enjoy yourself at the same time.
It combined the right aspects of academic work, allowing me to do research while also becoming the very best cardiologist that I could imagine myself being.
I thank you for considering University of Vermont Medical Center and our fellowship. I know this is a stressful time for all of you. I really wish you all the best. I hope we'll get to see you sooner rather than later. And I hope you get to check out our place and check out Vermont. And I hope you all agree with us that it's a wonderful, gorgeous place to be. Hope to see you soon.